Tens of millions of people are being urged to get flu and COVID jabs as soon as possible as fears ramp up of a winter, what they're calling twindemic.
Well, it's the UK Health Security Agency. They say they're braced for a resurgence of flu this year, worsened by lower levels of natural immunity that will then coincide, they say, with a new wave of coronavirus.
Well, joining us now for more is Dr Charles Levinson, chairman of private GP service Dr Call. Morning to you, Charles. First of all, how much more dangerous is this flu strain than past variants?
It's probably just a bit more dangerous, but there's a strain in Australia at the moment which is likely to come here called H3N2, which is a little bit worse than your average flu strain. And in a normal year, flu kills a few thousand people. In a bad year, we had 4 years ago, we had a bad year and it killed about 20,000 people because it was a strain that wasn't included in that year in the jab that was offered. This one is included in the jab, but it is a worse strain and it is likely to have a significant impact.
So this winter, the call really is for people to get these jabs. What advice is there for the public who, of course, don't want to get unwell?
So, I think the most important advice is to get your jab. And if you're in an at-risk group or elderly, you will be offered a jab on the NHS. If you're not, then your company may offer you one at work, and if they do, you should take it up because and you can get one privately if in quite a lot of pharmacies now. The point about it is not just that you don't want to get flu, but more importantly that the NHS just doesn't have any elasticity. So if it is designed to sort of function at peak activity level, which is not ideal because it means that then as soon as there is an increase in illness, it gets tipped over and can't cope. And it always gets tipped over by flu in the winter anyway. So what's now being dubbed the twindemic, flu and COVID, and a particularly bad flu year, make it inevitable that we will have problems.
Some people were worried about getting jabs, getting vaccines for COVID. Have you noticed if that's fed through into hesitancy in getting a jab for flu?
So there have been conspiracy theories about COVID jabs because it was new and because the government handled it rather clumsily and tried to mandate it, or threatened to mandate it. But we haven't had that with flu, but I think we probably do have some vaccine fatigue where people have just had enough of jabs, and we really need to overcome that because we need to take this seriously because the risk is the government panicking and putting us into another lockdown with all or social distancing measure of one sort or another, with all the terrible knock-on effects that has.